All right. Hello, everybody. Welcome. This is Irina Strunina and Kim Kyle. We are starting our second Diabetes 101 for Caregivers crash course. This is something that Kim and I decided to do this year to help people who actually least cared for, the caregivers, people who spend hours and days and weeks and years helping others while sacrificing their needs and forgetting about themselves very often. And we don't want that to happen. We would like this challenge for one person to be a adventure for everyone, the adventure that brings people together, empowers them, and makes them live life happy, healthy, and more fulfilled for much longer than it could be if you don't pay attention to this. Okay, so with that, we are here to empower caregivers today with knowledge and information that Kim is loaded with, overloaded with. I have some experience with that, but not as much as Kim has. So that's why I am so happy that she has time to spend with us and help us with this. And for that, I would like to introduce you to the plan for today. Where is my slide? As always, I have a challenge to share the slides. Okay, let's see how I can do it. You could see it, right? Okay, so our next slide here. Can you see it well?
Yes.
So on our agenda today, introduction, I just did half of it. Kim will introduce herself. Then we will very briefly go over the essential facts about diabetes. Uh, Very often when people see their medical professionals very often assume that we know about it. And they don't even stop to explain what is the diabetes. Um, and we will speak a little bit about essential parts of information that we all need to know. And then today, Kim will focus on nutrition. This is something that we are guilty of. We think we know what we are talking about, but if we didn't get the special education, if we didn't take specific courses, if we didn't read specific books, we may miss something. So, and Kim is an expert on it, so she will really help us with that. We will talk a little bit about emotional aspects of diabetes because this is something that everybody has to go through, and the way how to manage it, how to understand it, it's very important. We will talk about how we can help you. And if you have chance to ask questions, please do so. And then we'll show you the ways how you can work with us closer. With that, I will stop my little show here. Well, if I can find how to do that, that would be great. So I am, okay, there's an introduction. I am Irina Strunina. I am the founder of Diabetes 101 for Beginners, and I also started this group, Diabetes 101 for Caregivers. I am a caregiver. I was helping my husband when he was um, diagnosed, and it was already 20 plus years ago. He passed away 10 years ago from the complications that were really caused by the flu. But we learned a lot. I learned a lot, and I don't want people to struggle with this the same way as our family struggled. And Kim, please welcome to the stage. Let me stop my sharing.
Thank you.
and talk about yourself and what you are doing. And I'm so happy that you are here.
Thank you, Rena. I just am so thankful that I went onto your Facebook page. I don't know how long has it been? Has it been a year yet? I've been
Close to it.
helping
Close to
meeting
it.
with
Yeah.
you. But I wanted to support the online community, and Arena has an amazing collection of lots of people who are just gravitating towards Diabetes 101 for beginners for some help and some guidance. And she messaged me right away. And since then, we have gotten to know each other and we connect on a personal basis because I'm a caregiver too. I was a caregiver to my dad, and actually, it's the reason I'm a dietitian. So I have a lot to be thankful for diabetes. I try to look at it as, diabetes is really a wake-up call. It was a very big wake-up call for our family. We had no idea my dad was suffering with diabetes until a lot of things happened. He ended up in the hospital. We almost lost him. He had heart surgery and diabetes diagnosis all at the same time. So I decided to take my journey of my career somewhere else, and I decided to become a dietitian. I was 25 years old, living my life at the beach, having a great time, managing hotels, and I just went back to school and it's been the best decision I've ever made. But caregiving for my dad was the reason I went to be a dietitian. And I'm telling you, a caregiver, Verena will tell you that too. It is something that might be thankless, but you know that you're doing something to care for your family member because when people don't have help, when they don't have that caregiving help, the symptoms and the problems with diabetes can show up much earlier in their life, and that's what we're trying to prevent. We're trying to prevent diabetes complications, and I'm going to take you through some easy steps that you can take with your family member. Um, and it doesn't take a lot of effort, but you have to have some knowledge about why are you making these changes.
Absolutely. Yes. Thank you. Thank you, Kim. So let's move on. We don't have much time, only 2 hours. And I know how much information you have to present and show. So let's talk about three most important pieces of information that people very often are not knowing much about. And I would like to start from this magic combination abbreviation A1C. It's being discussed in our group all the time. It's being discussed in our support group meetings all the time. People asking each other, like, when people meet with each other in different country, they ask what state you are from. And if it happens in the same state, in the same city where you been, they ask, what high school did you go to, right? So when people learn that they have the same diagnosis, very often I hear, what was your A1C when you were
Yes,
diagnosed? So
that's
this
right.
is like ID,
Yeah.
but for caregivers who don't have this ID, sometimes, especially in the beginning, it's hard to know what they're talking about. So what is A1C?
So I have a slide on that. If you want, I can show you that. It lists all the numbers. Can I share my screen? Is that
Yes,
okay?
you can share it.
Okay. And then I will see if I can do this like you did, which was very easily. Um, the A1C, yes, is the one marker that we have that we can determine what is your level of diabetes, I guess. What is the severity of your diabetes? And I think in this group arena, maybe it was last week, somebody came on the group who was diagnosed at an A1C of 19. I don't think I've ever heard of anybody having a higher A1C. That's devastating. Your body is in severe trauma for sure. And most of those patients do end up in the hospital and they have to be cared for several days to get their blood sugars under control. But here's what I see in my office arena, and this is really upsetting to me as an educator. I'll have patients come into my office and they say, "Yeah, my doctor's been saying for years that I have prediabetes." And then suddenly, this year they've been diagnosed with diabetes and they're in my class or they're in my office getting some counseling. So, what I want you guys to know is the A1C is built around your blood sugar, how much blood sugar you have in your blood at one time. And if your doctor ever tells you you're in prediabetes, that is a wake-up call. You have to take instant action then because you can reverse prediabetes, but you cannot reverse diabetes. So there is a way, there is a strategy, much as what I'm going to talk to you about today, to help you get rid of prediabetes and never be diagnosed. But now that we have you here, you're a caregiver of somebody with type 2 diabetes, an A1C that is above 6.4. So 6.5 to 6.9 is an excellent A1C. That is still diabetes, but well controlled. Then we'll have people come into the group and into my office that have had A1Cs of 15, 16, 18, 19. It's like, wow. If your body can live very safely at an A1C of 6.5 to 6.9, anything higher than that can absolutely lead to damage within your body. The damage is from the sugar in the blood vessel. So when your A1C starts to become higher than a 7, or your loved one has a higher A1C of a 7 or higher, that is something that needs action. And oftentimes, that's when somebody's trying the diet strategy for the first time. And that can work. We have so many success stories within Arena's group, Diabetes 101 for Beginners. It's truly inspiring how patients have gone from a 15 A1C down to a 6 A1C and even below. But here's what I need to say. I love those stories and I think that's amazing. But don't kill yourself to try to get your A1C down under a 6.5. It's okay. 6.5 is very safe. Your A1C does not have to be 4.9 or 5.0, which is really nothing. It's not even pre-diabetes. So if your loved one says, "Yeah, I got my A1C checked," ask them, what is it? Now that you have some knowledge that above a 7% A1C, you really might need to help them a little bit more, take action, maybe go to the doctors with them and or ask for a referral to a dietitian like me. We can really help you understand why it's important to take action now. So an A1C, again, 6.5 to 6.9 is well-controlled diabetes. If you or a family member is in the pre-diabetes stage, that is also a time that you need to take action to prevent diabetes. So there's a lot that we can learn from the A1C. And I will show you another slide I have here. We have to wait for 3 months to take another A1C. And you might be confused. Why is that? Well, after 3 months old, if you can see this big red blood cell here, after the blood cells are 3 months old, they get really big and then they burst, and our body just reabsorbs it. So what we want is that biggest red blood cell to measure the sugar around that blood cell. And I'm going to try to draw something here. But if this is your red blood cell, the sugar is going to be on top of that red blood cell, and it can be a little bit, it can be a lot, but that's really what the A1C is measuring. How much sugar is attached to that red blood cell? Because you have to think of it, the red blood cell is your vehicle to get all the energy and vitamins and minerals from the top of your head to the bottom of your toes. Everything is basically just hitchhikes with that red blood cell. The sugar, the vitamins, the minerals, everything. So we can take that biggest red blood cell and we can measure what is the thickness of the sugar over the last 3 months. And that's where we're getting that percentage from. The baby red blood cells, we don't want to measure them. They haven't been in your body for 3 months. We really want to get those bigger ones to measure to get the best result of how has it been for the past 3 months. And every 3 months, you can get a new A1C because we want to measure those, once you started taking medications or diet strategies, there's not going to be as much sugar on your blood. And that is a good thing. That's going to go away. And maybe it might be a little bit, maybe we have a little bit here, but we don't have as much as we did. And that is how you can see your blood sugars coming down. Your A1C is also coming down. We can't capture, every blood sugar, but we can capture the red blood cell, which is going to be very accurate.
It's sorry for interruption. You actually described a well-planned trip. when you are going for a trip and you're packing your backpack, you want to have everything that you will need and will use during the trip and come back home with the empty backpack. So this is the best A1C strategy, right? To at the end of 3 months, to have at the end of your travel, to have as little of remainings from your packing. But if you accumulated the rocks and spare food that you picked up and souvenirs and everything, your backpack is becoming huge, and sometimes you need the second backpack. So it's actually becoming um, overwhelming, and you show up in a house at home and think, oh my God, what do I do with all this? And you start stocking in the closets and everywhere, and your house getting so
That is
full.
that's a great way to think about it because that's what the red blood cell is, right? It's just your backpack and how much are you going to carry in that? We need to carry vitamins and minerals. We need to carry oxygen. That's the main reason for the red blood cells carry oxygen through the body. So we do need it to be, without all this heaviness from the sugar and all the fat even. It's just we want to keep them nice and clean and have in 3 months have it not be loaded down with so many things like Irina said. That's exactly right.
All right. Well, okay, so A1C, this is important. This is why it is important to know the results because it's actually shows. Some people are buying their A1C kits and they start measuring it like every week. It doesn't show anything, right? You got to be patient. You got to kind of like uh, do what you need to do and do not expect that your A1C will change within a week or even a month.
That is true. Now, somebody who has a super high A1C, they probably do want to check it in a month to see if there's any improvement. And so, for
Mm.
somebody just newly diagnosed, you may have more frequent A1C checks, and that's intentional because the doctor wants to see if we're moving in the right direction.
Uh-huh.
But once you've, gotten under control, if you can get your A1C twice a year, that would be ideal.
Yes.
Every 3 months would be amazing if you can work that out.
Well, I know that from what I have reports in the Facebook group that a lot of times this is people who are really want to get everything straightened up, get their health under control. They focus on it and they make those appointments. They wait for those they plan for it, they go and they schedule follow-up appointments. So it's not just get your number and that's it. They go and speak with the doctor afterwards. So what is the next step? Now when we know that whatever we are doing is showing the progress, what is the next step? So these are the ideal uh, people, like patients who actually on a track to have their diabetes under control and not affecting their day-to-day lives as bad as it could be when you're really struggling and in pain and challenged all the time. Okay, so next, thank you. Next topic is the insulin. What is insulin? Everybody is talking about getting insulin shots, but I also know that a lot of people are not getting. I know my husband was not prescribed insulin right away. It came along much later. So is it everybody now destined to get insulin shots, or what is it?
Well, insulin, I can share my screen with you again.
Yes.
Insulin is a hormone that we all have in our pancreas. It lives in our beta cells that are populated in our pancreas. So let me go back here. Sorry, I'm showing you a preview of what's to come. Insulin is a hormone. We're born with it. Here's the most interesting thing about insulin. We are born with all of our beta cells that house our insulin, which lives in our pancreas. We have a full supply the day we are born. And there are lots of things that can happen to our supply of insulin. Insulin is the only way from the inside that we can remove sugar from the blood to the cells that need it. It is the only key that can unlock that door from your blood vessel to the cells that need it. So insulin helps the sugar escape from the blood vessel to get out of there. We don't want your sugar living in your blood. We want it to live in the cells. But insulin is the main way that you can achieve that. So it's very important. There are things that can happen to your beta cells, your insulin cells in your pancreas. Your body can attack itself and kill those cells. And if somebody doesn't have insulin, that would be type 1 diabetes. You don't survive with that. Thank goodness we now can make insulin and we can have people take insulin if they need it. But even if you have all your insulin cells, they just might not be working all that well. And I will tell you that can happen from hereditary, it can happen from sickness. There's a lot of things that can happen. It could be an autoimmune condition that can happen to the beta cell. So that insulin is so very vital to your blood sugar control. If you're in a crowded room and there's no exit, that's basically what's happening in your blood vessel. Where's the exit? We got to get out of here. There's too many people or there's too many sugars at one time. It can make you feel very claustrophobic. So insulin comes in there, and insulin literally will grab the hand of sugar. And I love this video. Insulin's like, come on, sugar, we're getting out of here. And insulin is the vehicle to get sugar from your blood to the cells that need it. Your cells run on blood sugar. From the head to the toe, every cell in your body runs on the energy from blood sugar. So it's not a bad thing, but there can be too much of a good thing. So you have to keep that in mind. So we have an empty cells throughout our entire body. And that's what the insulin is trying to find. It is trying to find a cell that can take your sugar and deposit it there. If that cell is full, then insulin has to go around to many, many, many other cells to find some space for that sugar, and that can take some time. If your cells are already full of sugar, like you've had a high blood sugar for a long time, maybe your blood sugars are always over 200, your cells are full of sugar already and they're not being used. So your body is making new cells. So insulin has to take a long time. And this is why you could eat really nothing, maybe a little bit of carbs, and your blood sugar still be high because insulin has not found that empty cell to put that sugar into. So that's the journey. That's the reason why your blood sugars could be higher, or your family members or your loved one can be higher longer. So what we need to do is to find a way, how do we get those sugars out of that cell so we can put the new sugar in there? Well, one true way is exercise. This is something we can do to lower our blood sugars because our muscles instantly need sugar when we're actively exercising. Your muscles can call to your cell and say, hey, send me some of that extra sugar. I kind of need it. I'm going for a walk, or we're doing some weightlifting, or we're sitting in a chair and we're doing some exercise. Anytime you activate your muscles, your body wants your extra blood sugar. So this is an excellent way to make room for the new sugars from the food that you're eating, today to get into an emptier cell. So exercise is a medication that everybody can take, whether you're, sitting in a chair exercising or walking outside or doing something inside, maybe some light weightlifting. There's a lot of opportunity that you can impact your blood sugars in that moment by being active. So walking, being active after a meal is essential to keep those blood sugars from having to be stored in your cells. Your insulin can work, but it takes a long time if there's too much work to do. So YouTube is where I go to find all my exercise videos. 10-minute, 20-minute, 30, 60-minute exercise videos. It can be 10 minutes can lower your blood sugar. You just have to do it. It's not a medicine that you can take. You have to be willing to do a little bit of work.
Definitely. I just sent my mom after meal. She's pre-diabetic, and I'm saying, Mom, before you lay down, I know you're tired. Before you lay down, do a couple trips around your apartment and look at the window, see who is out there, and do things like that. So I think this is not much to ask. And she's carrying around her walker, so this is extra activity. She needs to navigate between the furniture and doorways and things like that. But this is the way a little thing that we can do that helps, right?
Yeah, I specifically don't clean my kitchen until the evening because I want it to be a little bit dirty and the floors that need to be swept after dinner. I'm like, okay, now's my time to clean. Just vacuuming and just mopping up the floors or putting laundry away. That's exercise. Just a way to be active. Find a way to be active. If you have pets or if you have kids, the person in your house with diabetes, you might need to be the one to say, not to say, do you want to go on a walk? This is what you say. Let's go. We're going to go on a walk. I really want you with me. They're not even going to know what you're doing. You're just trying to help their blood sugars come down and they've been invited on a walk, invited to do, you know, a little dance party in the house or help you clean. There's a lot of ways that you can impact your caregiver by you being the example. I know this is the hard part because, you may have your own health issues, but because diabetes is so impacted by exercise, if you have a way that you can get your loved one person out of the house or inside the house to be more active around the mealtime, like Arena's telling her mom, I'm sure her mom's listening to her, but you don't ask, you say, let's go. We're going to find a way to make this work.
Our apartment is very small, so I cannot walk with her around it while I'm cleaning the kitchen. She is walking around, and then she may plug herself in front of the TV or something like that. All right. Okay, so we covered A1C. We covered the insulin and what it is and why we are paying attention to it. And now let's go to the topic of today's conversation. I did the poll in the group, and majority of people said that the nutrition is the knowledge that they are lacking the most. The second was A1C, so we covered that. Another one was the insulin, which we also spoke about. Let's talk about nutrition. And Kim, you have really good, I don't know, hour. If you have enough information to, I know you can share it for hours, but you have 1 hour to cover that topic.
Well, I'll probably get done a little bit sooner than that
Okay,
because I just want to really hit you at the core message that you need to know. And I'm taking from my experience of 19 years working at an outpatient diabetes center. I've seen every type of diabetes you can see. I've seen little kids, I've seen 90-year-olds being diagnosed with type 2 diabetes for the first time, type 1 patients. And so gestational, I have a big group of pregnant ladies with diabetes, and that's the temporary diabetes. But I have a lot of knowledge, and this is what I know that you need to know right now as a caregiver or even as a person with diabetes. And so let me get into that now. Can I make just a quick mention about the medications?
absolutely.
Okay, great. So I'll share my screen again. So we just talked about exercise being a tool, a medication for a high blood sugar. Your muscles want your sugar when you're moving around. But oftentimes we do start our patients on medications. And I know there's some controversy around some of these medications, but I will tell you they've been around for a long time. And we have great news in that these medications is the tool to help you get the sugar from the blood into the cell. That is the main action that insulin can do, but it might need some helpers at some point. As we age, we lose some of our insulin cells. Remember, we're born with all of them. So as we age and go through life, go through sickness, family hereditary, which in my case, because my dad had diabetes, that is truly my story as well. Metformin is a first-line medication. I like this medication. It's not always easy on your stomach, but it does the job. And here's how I explain metformin. For anybody in their 40s or 50s or 60s, you're going to know this explanation. If you remember watching Popeye as a kid, the cartoon that we loved, every time he was a very scrawny guy. But when he ate something called spinach, when he ate spinach, he turned into this muscular guy who can really get the work done. So that's how I explain metformin. It's just making your insulin cells stronger. So metformin goes in there and really empowers your insulin cells to get the job done quicker. So it just makes them stronger and helps them out to get your sugar out of the blood quicker. Glipizide is a medication that targets your actual insulin cells. The glipizide and the glimepiride, if your family member or person with diabetes is on those medications, it's actually encouraging your pancreas to get more of the insulin out to help lower that blood sugar. Insulin is insulin. It's almost the better treatment in some cases because you have insulin, but you don't have enough to get that sugar out. So adding insulin, and insulin would only be by injection at this point. I know there are some inhaled insulins, but I still think those aren't 100% working the best. And then these other medications are very interesting. You can be on four different medications for your blood sugars, and they're all targeting different areas of your body. That's what's so fascinating about diabetes medications. So the doctor's going to do their best to kind of figure out what is the amount of medication you need until you can do the exercise, the diet strategy. In my world, when I see somebody new with diabetes, they might have a very high A1C and they're like, I just want to try to do this on my own. My recommendation is to not do that. Let's get some medications on board to get your blood sugars better sooner, to stop the damage. And then let's work on the diet strategy, exercise strategy to permanently keep those blood sugars down. But I am a big fan of let's start something sooner. Farxiga is an amazing medication that tells your kidneys to not reabsorb the sugar. Your kidneys have an amazing function where we're going to reabsorb a lot of nutrition and energy, but this medication tells the kidneys just let that sugar go, as you're peeing in the toilets, it's gone. Januvia is a great medication that tells your stomach, and we have other medications for that now, but it tells your stomach to kind of hold on to that food longer so the blood sugars don't go up as quickly. Rybelsus is a very similar medication to that. And then we have the injectables that are really keeping the food in your stomach longer. And that's the job. If we can keep you fuller longer and keep the food digesting slowly, your blood sugars don't go up quickly at all, right? They go up very slowly. We'll have another whole conversation and another whole presentation in more detail on those medications, but I just wanted to let you know that it is not a bad thing to need medications. It is okay to start medications as soon as you're diagnosed and then get those blood sugars down quicker to stop the damage, and then you can work on the exercise and the diet strategy. So the goal is for your waking up blood sugars and your before meal blood sugars to be under 120. Now, the wake up blood sugar, there's some weird things going on at night that can cause your blood sugars to be higher longer. So ideally less than 120, but if it's a little bit higher than that, don't worry. In 2 hours, so the moment you eat, starting the moment you eat, and in 2 hours, where are your blood sugars? Yes, the blood sugars are going to rise. And that's what I hear a lot of fear about with my patients, with the caregivers, like, oh, his blood sugar was so high after eating. Well, how long? Was it at the hour? The blood sugars might go up, but as long as they're coming down under 180 in that second hour from the start of the meal, we're doing okay. Now you can exercise, you can make that happen quicker, so you don't have to wait 2 hours to check your blood sugar. You can exercise and within the hour after eating, and that's going to help the blood sugars come down quicker. But if we can get them under 180 in 2 hours, that's the first step. So high sugar levels are caused by maybe your insulin cells just aren't working to capacity. There could be something going on with that. There could be a genetic history where insulin cells are just not as strong. In some families, my family included, this is what happens. But ideally, the one thing that definitely not ideally, but the one cause of super high blood sugars very quickly is liquid sugar. Liquid sugar is the most you will have the highest blood sugars when you're drinking juices, sodas, lemonade, sweet tea, and I live in South Carolina, so that is the beverage. It comes out of the water fountain, actually. No, that it doesn't, but that is one of the main drinks that we have here in our area. And yes, it's traditional, it's lovely, but it's going to raise your blood sugars very high. Being sedentary, not activating your muscles can absolutely cause higher blood sugars. So if you're eating a normal meal, your blood sugars can be high just simply because you're not moving around. We want to move that sugar out of the blood as quick as possible, and we can do that just by being active. I mean, I can just raise my head, raise my arms above my head, sitting in a chair, and that's some type of activity that can work. If you're not taking the medications that the doctor prescribes, so you have to maybe ask your family member, and this might be a little tough conversation, but have you been taking your medications? Sometimes they are, sometimes they aren't. You can, maybe help them to remember to take their medications, but I wouldn't be, giving them, some, I guess, a hard conversation. We don't want to be yelling or screaming at our family member with diabetes. We want to say, listen, I really want you to get better, and maybe I can help you remember to take your medications at dinner or before bed. Let me set a reminder because maybe they're just very, very busy and they have forgotten. Stress can raise blood sugars. I'm telling you, it's just amazing how stress can impact your blood sugars. It creates this different hormone that comes into the body that blocks insulin. And so we do have a lot of stress in our lives. And you might notice if you're checking your blood sugars that they're higher on the days that you're maybe fighting traffic or something's happened within the family. Sickness raises blood sugars, and that's kind of a good reason. If you're sick, your body needs more energy to fight the infection, and energy in our body is blood sugar. So your body can make blood sugar if you're sick, if you're fighting infection, and your blood sugars naturally go up. And dehydration. We have got to get into the habit of drinking at least 16 ounces of water as soon as we wake up. And then throughout the day, every hour, at least having half of that, about 8 ounces every hour that we're awake. You will notice if your urine is very dark in color when you wake up, we're all dehydrated. But once you get through the day, if it's a much lighter color, you are in good shape. You are becoming hydrated, and that is a good way to see if you're dehydrated versus hydrated. Critical blood sugars, if your family member is like, hey, yeah, my blood sugar is 300, 400, 500, that is nothing to just put on the side table. I mean, that is something that action needs to happen. Maybe they have forgotten their medications. You can ask them to take their medications. If you're here with diabetes, definitely do that. Drink water. You become very dehydrated with high blood sugars. This can become alarming, especially if a patient is feeling sick, they have pain in their stomach. You may need emergency care. There is nothing over a blood sugar over 200 is a critically high blood sugar. So if they've been 300 for a long time, that is something that needs to be resolved quickly. And again, as a caregiver, our role as a caregiver is to be that support person. I know it's easy to just point fingers and say you have to do it this way, but gentle encouragement is absolutely going to be best taken by your family member. But assisting with meal prep, and that's what we're going to get into now. Medications, recognizing higher lows. Take your family member for a walk or the person in your family with diabetes. Just encourage gentle support, emotional support. But you need that too, and that's why we're here. Okay, so in my office, I am always bringing up, what are you drinking? What are you drinking? And ginger ale is something that we all drink when we're not feeling well. But it's interesting. Many people don't understand ginger ale is still a soda. A soda is a soda. If you're drinking carbohydrates, you are causing your blood sugars to be higher longer. So I just want to show you a side by side of a diet drink versus a regular drink. So a 1 can of ginger ale, the total carbs is 36 grams. Now, if you're drinking something, I recommend if it's 5 grams or less will not impact your blood sugar. So a diet drink is going to have 0 grams of carbs. So I'm a fan of diet drinks. I know there's some controversy out there, but if you're drinking something that has sugar in it, it's going to show up as a carbohydrate. A liquid carbohydrate is the most damaging to your blood sugars. I'll have patients with 200, 300 blood sugars all the time, but they're drinking a lot of sugar through the day. So this is one thing that you as a caregiver can just not bring in the home. This is where you might have to make some changes as well. This happens every single day in my office where the parent or the husband or the wife or the child is not willing to avoid bringing these into the house. These can be very tempting for the person with diabetes to just gravitate towards. So if you can start here, nutritionally speaking, this is the right strategy. Diet drinks, water. Yes, Irina.
I apologize for interruption, but I wanted to bring one thing to everybody's attention, and this is something that I learned in a very, I was shocked. We all were thinking that orange juice is a healthy drink, especially fortified with the vitamin D and sometimes some other vitamins, so and calcium. So you think this is healthy drink. But if you compare the nutrition label of orange juice and say ginger ale or Coca-Cola or whatever, the amount of sugar sometimes even higher than the amount of sugar in the soft drink. So, looking at those nutritional labels and talking about sugary drinks, this is something to be aware of. So, that's sorry for interrupting.
No, no, that's an excellent, and I love that you mentioned that because you have this experience. You went into this without any knowledge either. So this is your true experience, and I love hearing from you when when I'm doing this presentation because and that is true. Orange juice is healthy for you, but it's way better to eat the orange, chew it, swallow it. You have a much slower absorption of the blood sugar when you're eating the fruit versus drinking the juice. And smoothies will go into that. Once you blend the orange or you blend the apple or you blend the strawberries, now it becomes drinkable. So the absorption is very, very quick. So that's, several things that we talk about in my office. The first step, this is the first step. The next step is to learn something called the plate method. This is a visual way to address your food groups. Carbohydrates are still an excellent food group. You don't have to demonize carbs. Carbs are still fun to eat. We still want them. They give us energy. But I can hear some people in the group sometimes say, oh, you eat carbs and you must be a really bad person. That is not true at all. Carbs is our energy. And yes, we can eat less of them, and that's going to improve our blood sugars because carbohydrates, the group of foods that raises the blood sugar quickest, is also our energy source. But yes, that is the one that I'm going to talk the most about today on how to manage carbohydrates in the diet. But what I want to show you is having a full plate of food is necessary. Your family member, the person that you love with diabetes, does not want to be hungry. I promise you that. So if you can find a way where you're going to change for the entirety of the family, you can start using this very, very simple strategy to make instant impact on your blood sugars, your family members' blood sugars, is the plate method. Diabetes.org. That is the place to go. You will find so much information there about plate method. You can Google the plate method and come up with a lot more designs of plates that might fit in your lifestyle. Maybe you're vegan or vegetarian, or you only eat fish. You can find lots and lots of plates. Maybe you're gluten-free. Carbohydrates are good for us, but traditionally we eat too many at one time. So carbohydrates will digest the quickest into blood sugar. They're digested quicker. They have the carbohydrates. Carbohydrates do turn into blood sugar. So we have to minimize that impact on our blood sugars by minimizing the carbohydrates at the meal. But it would consume all of the foods that you see here. We have bread, we have sweet potatoes, we have fruit, we have beans, we have rice and pasta. These are all carbohydrates, can still fit in the diet, but we might have to change how we construct our meals and how we plan our meals. And I do this every day. I follow this strategy as much as I can. You have to get used to looking at labels, the nutrition labels, and I want to give you a very easy way to look at this. Right now, I'm going to show you two things I need you to look at on a nutrition label. The first one is the serving size. Now, this is a weighted serving size, but about a small apple, a small pear, if you can hold it in your hands, that's about 3.5 ounces. And now the next thing you want to look at is the total carbohydrates. That's the only number that we're really gauging the balance of the meals on is just the total carbohydrate. Sometimes the carbohydrates, the food has sugar in it. It doesn't mean that's a bad food. It does not mean that at all. Sugar, in this case from fruit, is natural. It was born with it. So let's give them a little bit of a break. Yes, you can have fruit. Now, we want to look at the total carbohydrates on the label. So this apple, that pear, it fits in the palm of your hand. This is about 11 to 15 grams of carbs. There's a little bit of a range. But remember that number 15. 15 would be one serving of carbs. We're going to minimize the servings of carbs in your meal, and I'll show you what that will look like in a big picture. So, for most of us, women would be on the lower side, men would be on the higher side. The one thing that we know that we can impact our blood sugars is the amount of carbs we have per meal. So, 30 grams of carbs up to 60 grams of carbs per meal. Now, if you're an athlete and you're training for the Olympics and you're, training 6 to 8 hours a day, you're probably eating 200 to 300 grams of carbs per meal because your muscles need the energy, your body needs that energy, but you're quickly using that because you're active. If that's not you, if that's not your family member, then yes, we do have to reduce the carbohydrates to have the most impact on our blood sugars right away. We don't want to avoid carbohydrates. That leads to demeaning a group of food that's very good for us. That leads to disordered eating. Oh, carbs are bad. I must be bad if I eat carbs. So we're not doing that. We're accepting carbs as part of our diet, just not the main part of our diet. So I have pictures of what 30 grams of carbs looks like, 45 grams of carbs, 60 grams of carbs. So it adds up quickly. I will tell you that. It adds up very quickly. 2 pieces of bread, that's 30 grams of carbs. One banana, that's 30 grams of carbs. So if you're on the lower end, and that would be me, as a woman, menopausal, I'm not as active as I used to be. So I'm trying to keep my meals between 30 and 45 grams of carbs. So if I have a banana as part of my breakfast meal, that's fine. But that's the only carb that I'm going to have in that meal. If you want bread, great, but that's the only carb you have in that meal. And then I'm going to show you how to build up that meal so it's more filling, more sustainable, but we're not going to be adding more carbs. Any 1 cup of cooked starch, like in this case, rice, or we could say pasta, we could say quinoa or couscous, or all the grains, they can be high fiber and be very, very good for you. But 1 cup after cooking is where we want to stop with that grain. That is going to be 45 grams of carbs for one measuring cup of a cooked grain. And oftentimes that may be the only carb that you have on the plate. And then we're going to build it around it so we can feel full and energized after eating. Cereal is something that we all love to eat, but I will tell you, it's one of the higher carb foods that you might consume. And just by polling and doing food diaries from people who have eaten cereal, we are not eating a cup of it. And so if you have a cup of whatever cereal you like and you add your half a cup or a cup of milk, you're eating 60 grams of carbs. That is a lot of carbs for a small amount of food. So the carbs add up quickly, and this is what you need to pay attention to. Carbohydrates is what I really want to teach you first. I want to get you enough information on that, and then we're going to go into other talks about other food groups. So carbohydrates are good, and I want you to see on a plate where the carbohydrates will go. Now, the old portion, this might be you now, where half the plate could be dedicated to carbohydrates. What we want to do in the new portion over here, we want to not restrict it, but we want it to take up less space. And that less space is that one measuring cup. I use this every day in my classes. I use this every day when I'm counseling patients. For a woman, if your family member is female or if you're preparing the meals, a woman's fist balled up is about a measuring cup. I have a plate here. Oh, it's going to be hard to see. But just like this plate, you put your fist on the plate, and that's about right for the section that you want to save for the carbs. Everything else on that plate is not going to be carbs. So we're going from the old plate to the new portions. And the numbers can be confusing. The label reading can be confusing. That's why I love this visual part of how to visually prepare the meal so you are not going to be overloading the plate with pasta or rice or beans or corn. I'll go into all of that.
Can I add something else to it that
Yes.
I learned is a very useful piece of information? We're talking about the plate method, but we need to choose the right plate. So people are different, and the tall 6 foot man versus 5 feet female have very different demand in nutrition, right? So if
Yes.
we give the big man's plate to the small woman, it will be overload. And if we give the small women plate to the tall male, or even ladies could be that tall, doesn't matter. It will be too small. They have more body muscles that they need. So a very good way of measuring the plate is your palm. So you open like your palm as wide as you can and put it on your plate. So if the plate goes right around your fingers, that's the size of your plate. If it goes way further, then it's probably too big. Or if it is too short, it's a saucer, it's probably too small. You need more to be satisfied and fulfilled and live comfortably till the next meal. Sorry.
Yep. Yep. And that's where you come up with like your fist representing a measuring cup so you know about the portion. But even the men, my guys, and this was my dad as well, he loved the carbs. But if I could put around that plate more veggies, more meat, he was still satisfied with less carbs. He was still full. And that absolutely was one of the great strategies my mom used to help him control his blood sugars. So that's what we're looking at. We're looking at for men or women, we're looking at taking a cup or a cup and a half. So men, yeah, that's right, Arena. Men probably need a little bit more carbs than women do. So a cup to a cup and a half to maximum 2 cups for somebody who's an active, tall man might be the right strategy. But building around that plate with foods that don't raise blood sugar is also most important. Nobody wants to be hungry, but we want to be full on foods that don't raise the blood sugar primarily. So in this plate, we have a cup of potatoes. This would be something maybe Arena and I, maybe proper portions for us. But if the plate is a little bit bigger because you're a tall man or you're serving your husband or your son their meal, yes, you can definitely, look at that as, increasing it to a cup and a half or 2 cups even for that male family member or that loved one that has diabetes. So foods that don't have blood sugar, or I'm sorry, foods that are low in carbs or are really not main carbs is how we want to build the plate. This is the beauty of the plate method. It's going to be a lot of food, but we're going to control the carb portion by sectioning it into an area that still looks plentiful, but it's not going to be overtaking the plate. So if we go to Olive Garden or any Italian restaurant, we get that plate of pasta. The pasta covers that plate. And clearly, visually, you can see, you don't even have to know the numbers. That's a lot of carbs coming into that plate. So dining out is going to be 2 or 3 meals worth of carbs. So, you can do things like take some of the pasta and put it in the to-go box. There's a lot that you can do when you're dining out. Leaving some on the plate or sharing your meal. A lot of my couples are doing this. They're sharing their dinner meals. They might get an extra salad on the side, but they're sharing the carbs in the meal. That can be very helpful. So there's lots of ways around it, but ideally, when you go out to a restaurant, that is not those are not the right portions. Is that something that you and your husband struggle with, Arena? Was dining out?
Well, actually, especially at the end, we were sharing portions, and we not that often were going out. He was an amazing cook, so he was the cook in the house, and because he was still not educated on diabetes, he was doing the best he can in that term. And he is was from Italian family, and his mom was chef, actually one of the first TV shows hosts in the past in New York in the 50s. So he learned how to cook Italian way. Starch had to be at every meal. And if we have a pasta, we also will have a roll of bread. So this was really disaster. And it's hard to change the habit, and especially if you're talking with a chef. So um,
Yeah.
wasn't the ideal situation.
Yes, right. Traditional meals, even here in the South, and I'm from the Midwest originally, and we had a lot of potatoes and corn together, or rice and potatoes together. We mixed a lot of the starches, and but this is something that you as a family can do, or if you're the one who's cooking for the family, if you're having the pasta, maybe don't add the bread, or if you're having the pasta, you could make it a lower carb pasta. They have those now. Alternative pastas, there's other ways you can do it. But the most natural carb is going to be the slower digesting. So the actual baked potato, the actual corn from the cob, that's the best strategy. The more natural, the higher fiber the carbs can be, the slower that they're going to digest. Protein foods is just as important. I am telling you right now, carbohydrates need protein. When you have just a plate of pasta or just a plate of rice, your blood sugars will go up much quicker. Protein has the role to slow the digestion. In the stomach, carbohydrates are digested in minutes. They can leave the stomach and start being absorbed into your blood. But protein, not a carb, and it takes hours to leave your stomach. So that's a beautiful relationship that carbohydrates can be slowed down by protein when you eat those together. So it's one of the main strategies we teach as part of this plate method, that you identify what are protein foods that you like, that your family member likes, that your loved one likes who has diabetes, and let's bring more protein into the meal. I know there's a lot of price, challenges out there these days. Um, and fish, is right up there, but there are some cuts of beef and there's some cuts of chicken that, you could usually buy a little bit less expensive if you buy in bulk. Oftentimes you're going to pay a lot less for them. But protein, just for a woman's, if this you're feeding a woman, it's right here. That's about what they need. That would be 3 ounces. If it's a man, their palm of their hand is going to be bigger, so they need about 5 to 6 ounces. So whatever the palm of your hand is that you're feeding, that's about the right size. Is that what you would say, Arena? Is that what you guys did? Yeah. So protein comes in all shapes and sizes, beef, chicken, fish, eggs, nuts, peanut butter, even beans have some protein. There's a lot of advantages. So have a carb, even if it's for a snack, adding a protein is going to be ideal. There's a huge group of food called non-starchy vegetables. And if you go to diabetes.org, you're going to find this whole list of vegetables that you can pull from to add to the plate. And remember, the vegetables that are not starchy are these, and we want this to take up most of the plate, almost half of the plate. If your family member doesn't like vegetables, you can add more protein. You can add other things that they like. Maybe they like the same vegetable, they don't mind having it over and over and over again. But pull your family member, give them this list and say, what do you like here? Check off some things. You may be surprised that you didn't remember they liked green beans. Maybe you didn't remember that they don't mind to have some bell peppers, on their plate. Just randomly to something to fill up the plate. So there's a lot of strategies that you can identify the foods that your family member likes or that you like that you can have in this category in larger portions. I do some cooking videos, and this is one of the videos I did of how to very easily, very quickly create a plate method using convenience foods and frozen foods. This is what I eat. This is how I cook. So you don't have to be a chef. It's wonderful if you are a chef and you know how to cook from scratch. That's great, but most of us don't have a lot of time. So I used a frozen bag of vegetables that I ate entirely. I ate the entire bag. So one bag of steamables for you or your family member with diabetes is a great way to start filling up the plate. These are all non-starchy vegetables, so I filled half of my plate with those. I love French fries. I love sweet potato fries. Carbohydrate wise, they're about the same, so whatever your choice is. But like Arena was saying, you gotta man that's the part that you have to manage. You can use your hand as an example. You can use a measuring cup as the example. You can use your balled up fist as the example. But that's about where we want those sweet potatoes to fit. That is the carb for the meal. Now I'm going to bring in that real good frozen chicken. I really like this brand. It's quite low in the breading. It still has some breading to make it crispy, but it's very minimal. So we're not getting a lot of extra carbs from the breading. You could just find also the grilled chicken. Maybe you have a rotisserie chicken left over from the night before. You can pull some meat off of that. But we want to have the protein. That's the only way to slow down the digestion of those carbs. So this is a very easy plate. I'm using my favorite no sugar added barbecue sauce. This was very filling, a lovely meal. I enjoyed it. I had French fries. I had things that maybe you don't think you can have. And this is a very simple way to make this. Um, and I think most of my patients in my career, my 19-year career being at the diabetes center, we want to cook quickly. We don't want to spend a lot of time in the kitchen.
Can I add something else to
Yes.
this? I see the items that you showed in this picture. I also read a lot of posts in our Facebook group, and people start counting every single gram. And I can tell you how much it will be criticized what you are showing here, because they will talk about the carbs in the breading, they will talk about the carbs in carrots, they will talk about the carbs in potato. The I think the most important thing to remember about is that our goal is not to take from the person everything away and give them something that they're not used to. It just slowly switching the accent to something that is helping their body instead of damaging their body. And if we do it slowly and gradually, a year from now, you will find that your family eats much healthier and uses much less of certain foods that you were using in the past that brought to this condition. So I just wanted to bring this up. Don't be very critical when you are shopping, when you are looking at it and say, if these are chicken nuggets that are breaded, I'm not taking it. If your cared one, your loved one, used to Chick-fil-A chicken nuggets or McDonald's chicken nuggets, it will be already improvement compared to those. So do this gradually, and eventually you will find better recipes, the ones that, you know, are being liked by your family members, but don't try to create a revolution on the spot. It's patience and consistency that brings the results.
That is an excellent point, Irina. Thank you so much for bringing that up because that is exactly right what Irina says. You don't count every carb. We have categories of food that are carbs. That's what you count. Broccoli, carrots are not carbohydrates. They have carbohydrates in them, and this is the confusing part. But every plant, anything we grow, has carbohydrates by nature of just growing and cellulose and using the sun for energy. But those carbohydrates are less impactful. It could take hours and hours for the carbohydrates from carrots to even show up in your bloodstream, if at all. So there are certain foods that we count strictly as the carbohydrates that we measure. In this case, I would count the breading, which is only maybe 4 grams of extra carbs for the amount I had. I would count the 2 grams of carbs in the barbecue sauce and then the cup of sweet potatoes. So any cup of starch, whether it's a rice or a pasta or a potato or French fries, corn, any cup of starch, you're going to have about 30 to 45 carbs, 30 to 45 carbs. That's generally a good rule of thumb. So if your fist takes up the space on the plate where you can put about a good cup of whatever starch you want, that's what you count. But the half a plate, those vegetables that are not starchy, you're going to have to train yourself not to count those, that it's not necessary. Especially if somebody's taking insulin based on the amount of carbs they eat. I would never add that to the calculation. But that's a very, very good point because if if I didn't know better and I had to count everything, I just throw my hands up and say, this is just too hard. I can't do this. This is ridiculous. My brain is exploding. So only count the foods that you have to. And those are just strictly the carbohydrates. Go to diabetes.org. They have a whole list for you of the carbohydrates. And that's it. Everything else is minimal. Now, I'm very quick and easy. I don't like to cook. I never found that as being fun for me. I don't want to take time. I don't mind choosing a frozen meal to use as part of my meal planning. In this case, I like Healthy Choice or Lean Cuisine. And the reason I like those the best is they are the lowest in sodium. And many of my patients are lowering their sodium due to their kidney issues. So it might be something you need to pay attention to when you're shopping for your family member. Sodium higher than 600 milligrams per meal is something I wouldn't bring back into the house if that's what you're following. Some people don't have any problem with sodium and they can have as much as they like. But some people, if it's a kidney issue, I would definitely reduce the sodium. Sodium causes water to be held on to the body a little bit longer. And that's what's really puts a lot of pressure on the kidneys and can cause more damage. So sodium in food, so frozen meals are fine, but you gotta find the lower sodium ones. So Healthy Choice, Lean Cuisine are my top brands. Now, this I love Healthy Choice so much because they created a meal that was the meat and the vegetables for my meal. That's wonderful. I love that. I didn't have to think about it. And I'm choosing to have fruit as my carb for the meal. This is 1.5 cups of fruit. This is a lot of food for a very little amount of carbs. So often I'll hear, oh, you can't have apples, you can't have fruit. But I will tell you, this is not how you got diabetes, but this is how you can definitely get lower blood sugars. The volume is so high, but the carbs are very low. So when you're thinking about having a carb with your meal, fruit is an excellent choice. So 1.5 cups of fruit is only 25 grams of carbs. 1.5 cups of rice is 60 grams of carbs. So when you switch over to having some more fruit as the carbs in your meal, you're going to have lower blood sugars. I know it's controversial, but I'm telling you, it's the way to go. What are
And
your thoughts on that, Arena?
and in most cases, thank you for I just you asked me before so in most cases fruits are going last. So your stomach is getting enough to work on. So when the fruits coming on top of it, they will be processed the like much later and will not cause that bigger spike in your bloodstream.
Yeah, we have, and in this case, I probably would eat the meat and the veggies first, which is, I think, what you were talking about. You have the benefit of getting that protein and those veggies in first, and then having the fruit. And this is with any carb. It could be bread, it could be rice or pasta or a potato. When you have the carbs later in the meal, but focus on the protein and the veggies first, you're naturally going to have a slower digestion of carbs. That protein's going to hold it in your stomach longer. It's almost like glue to keep the carbs, digesting much slower. This is a great strategy. Do you ever use frozen meals in your daily preparation of food, Arena?
Sometimes frozen vegetables, but not really. As I said, my husband was he just loved to cook, so and he loved to cook everything from scratch. I'm from Russia. We didn't have much of a selection of frozen meals,
Yeah,
so we really were cooking everything, and that's how I was taught to cook. So
yeah,
it's easy to use some frozen vegetables. It's already
yes,
prepared, cleaned,
yep.
so you just throw it in the bowl. But in terms of protein, I usually use from the raw.
Got it. Here's a plate that I got from just doing a Google search, the plate method, and asking for the word image. This is another way to do it. So for somebody who is maybe a larger person, I wouldn't increase the carb amount, but what Arena says is, the palm, the hand, if it's a larger person that you're feeding, yes, they might need a little bit more. But I would increase the protein and the veggies. That's how you increase the volume of the plate without adding carbohydrates and without causing a higher blood sugar. Now, this is all if your family member that you're caring for is in on the process. You can't force somebody to change. You can, if you're providing the meals and you're doing the shopping, you have a voice there that you can help not bring things in the house. If you're portioning plates for your family member, you can add more veggies and protein to their plate, less carbohydrates, get the regular drinks out of the house. But again, everybody is sovereign. We are in charge of ourselves. Um, but your job is just to do what your ability is. And if you can in any way help that family member understand, you're gonna still get full, but let's reduce the carbs by you doing it. You're doing the same thing that they're doing. It's most helpful. Did you find that too, Arena, when you were with your husband?
Absolutely. In our family, we didn't cook two dinners. It was one dinner for everybody, and especially when I became the cook because he was not able to stand up for long. Um, our kids were eating the same meals that my husband, who was really experiencing a hard time with his kidney and gastroparesis and everything. What is healthy for him definitely is healthy for your other family members. The most important thing to make sure that the proteins and veggies are there, carbs, kids will pick it up, no sweat everywhere. And for my husband, as I said, Italian descent, he had to have carbs. It just the amount that he was consuming was much smaller. I didn't cook for many different menus. We all were eating the same, and that diabetes is a team sport. You got to be a team member, maybe the coach, maybe the massage therapist, maybe a dietitian for the family, but take a role and just do it to serve the best everyone you're serving. So
Yeah, even if you don't have a portion control or a measuring tool, I mean, you can eyeball it. This is what you don't have to be precise. You have to just be in the ballpark. But for a woman, this would be a lovely plate. For a man, I would have maybe a half a cup more of the starch, and but increase the veggies, increase the protein. The protein, again, is that glue that's going to keep that carbohydrate digesting longer. Protein is essential. It's one of the more important food groups. I don't mind getting foods that are already prepared. I often would buy these for my mom and I. These are ready to eat rice. This whole container of rice is 80 grams of carbs. So this would be perfect to half of it for you, half of it for your family member or your other family. If you want to cook the pasta or the rice fresh, that's fine. Using a measuring tool can be very useful, or just eyeballing it based on the size of their fist. That's the section of the plate that should come from carbs.
well, just one quick step away from your conversation. Um, we hear this all the time, again and again, about this trick of cook your starch, potato, pasta, rice, cool it down, put in a refrigerator, and then reheat. I just found the term, actually, scientific term for it. It's called starch retrogradation,
Yep.
and which converts the carbs into the like simple carbs into more complicated carbs that are getting through the digestion process much slower. Is it correct?
Yeah, that is correct, Arena. So when you cool down or put it overnight in the refrigerator, it has to be cooled. So the rice, the pasta that you make, the potatoes that you bake, you can put them in the refrigerator. The bread you can keep in the freezer. When you're reheating those, and how I explain it is some of those starches are no longer active. So you can eat that same portion and have a completely different blood sugar result.
Mhm. That's
Yeah.
what something that a lot of people can use because we see so much I don't know, upsetment about the fact now I cannot eat anything I like. Bread is my love, and I'm suffering from. Well, use that trick. Well, lower the portion and use it through the refrigerator. Add one more step for your bread. Put it in the refrigerator right away and take it out from there. It really will help to, yeah.
Toasting it does help the most. From the freezer to the toaster. Yeah.
Mhm.
And honestly, let's just stay on this page just real quick. And I like what you said also, Rena, because it's reminding me of things to talk about. Because as a as a caregiver yourself, these were your questions. I don't tell somebody they can't have something. I never will do that. Drinks, that's different. Yeah, I would say, let's get off the Coke, let's find something diet. But you want a dessert? Oh, you want to have bread or you want to this is what we do. We just put it in that section. If it's a dessert, it goes in that section. It becomes the carb for the meal. So it's not that you have to give up everything, but you do have to be thoughtful about it. Do I want the rice? Do I want the ice cream? Which one do I want the most? And that's what you put on the plate. So you're not depriving yourself. You're still committing to the strategy. You're just choosing, making a little extra choice. What do you want the most? And I did this with my dad when he would come for parties, at our house. And I say, Dad, do you want the cake or, you want the potato, whatever we were having in the meal? He's like, oh, I'd much rather have the cake. So his plate would be full of meat and vegetables. And then he would absolutely have the cake with the rest of us when whatever we're celebrating. And his blood sugar stayed great. He enjoyed his food. He didn't deprive himself, but we still helped him control his blood sugars. And then as a family, we would be going for walks with my dad. Towards the end, he had a lot of neuropathy. He wasn't able to walk as much. But, when the babies were young, he would, play with the kids and he get a lot of exercise that way. And so it doesn't have to be exercise. It can just be playing with the family, the kids, or, helping you clean up. There's a lot to do, but that carb can be exchanged for other things. We used to call this whole process the exchange system. Do you remember that, Arena? Now we just call it the plate method. Whatever carb that you want, try to keep it under 60 grams of carbs and it's your choice. What you have. I'm not gonna be mad at you if it's ice cream versus rice. I would make that same choice too. Um, what I want to do, if you guys don't mind, I would like to show you diabetes.org. I don't think I've ever done this in a presentation, but it's so helpful for you to know where to go for easy access information. And there's just a few things I want to talk about. Um, let's see if this is it. I don't think that's it, right? Okay. Oh, I can get on here, right? Are you seeing this okay? Can you see this, Serena, what I'm doing here? I'm typing in diabetes.org. Can you see that? Let me reshare it. Okay. Let me reshare it. Here we go. Tell me now if you can see it. Okay.
Yes.
All the list of carbohydrates is right here. Recipes and menu strategies for days and days and days. You could never get through all of them is on here. if if I have handouts, but this might be the better place to go because everybody's different on what they like, what they don't like. And so what you're looking for, this is all about donating and you can just skip all that. But I would go under either newly diagnosed, that's going to give you some great information, life with diabetes, diabetes prevention, just on type 2 diabetes. But life with diabetes is going to get us to more of where we can find the overview of the food groups. So I'm just scrolling through here. I think the pictures are beautiful. They have living with type 1. Let me see where are the nutrition sections. But if you can find the nutrition section, maybe it's over here. Here we go. Food and nutrition. So I went to the top 3 lines on the upper right top 3 lines. Okay, now we can go. Here's food and carbs. Understanding carbs. This is where you want to go. Carbohydrates, this is what we count. And I love that Arena stopped me and said, there's lots of foods with carbs in it, but the only ones that we count are the ones that are actually we categorize as carbohydrates. We have vegetables that are starchy carbohydrates, and we have vegetables that are not starchy. So those are the ones that we don't count, the not starchy ones. But if we go down here, more about carbs, we'll just keep clicking until we find more information. Here's the starches. These are the main categories. They'll talk to you about fiber. High fiber carbs are so much more beneficial. They don't raise the blood sugars as quickly. Protein, Foods with high in fiber take a longer time to digest, so that essentially improves your blood sugars. I have started loving these high fiber, low carb wraps. Oops, it's going to be hard to see this. Oh, it's called the Mission Carb Balance Tortilla. I'm using that now instead of bread because it's so much fiber in there. The digestion is very, very slow for those foods. We have quinoa, barley, bulgur, oats, brown rice, farro. These are some grains I've never even heard of before, but if it's something that your family eats, that's a carbohydrate. That's something that you're going.
And there is also another thing that a lot of times I hear a lot of people saying, "Oh, my, uh, spouse, kid, parent would never eat anything but pasta. They need their pasta." Experiment. Don't cook the whole big pan of quinoa, but have a small 1 quart saucer with quinoa and just have a tablespoon on a plate. Let them try it because I do remember how I introduced my husband to the buckwheat. We had great recipe for meat with some special sauce on it, and I did give him a good portion of buckwheat, and he was like, "What's that?" It's buckwheat. He didn't know what it is, if he likes it or not. Generally speaking, he wouldn't like it because it's a little bit dry and it's a little bit has this special texture. But with this sauce and with this meat, he was eating it. And then he asked for the second. I said, "Everything?" And he said, "Yeah, with that meat, the way how you cooked it, anything will go." So yeah, altogether, I like the complex of, the complex flavor of it. So experiment,
Experiment.
try, and something maybe definitely will not go. Nobody liked it, so scratch it out. But add something to your repertoire, not just the potato, not just the rice. Maybe even the rice has so many different varieties. Try different varieties and
Yep.
dressing it up. Different spices really helping to make peace with the new flavor.
I think we hear a lot about net carbs in the group. So net carbs is not recognized by dietitians. Now, net carbs has a place, but if, for example, one of the package I have for that low carb tortilla, it says net 2 grams of carbs. That doesn't mean that when you eat it, it has the effect of only 2 grams of carbs. That's actually not true. It is less carbs than what the label says if we take some of the fiber off the carbs, but you can't take all the fiber off the carbs. Some of that fiber is still absorbed into the blood, so we have to account for that. So in this case, I would say don't worry about net carbs, honor the total carbs, but just choose high fiber foods. High fiber will be 3 grams of fiber or more on that nutrition fact label. Fiber sugar is already totaled into that total carb number, but just glance at that fiber. If it doesn't have fiber in it, it doesn't mean you can't have it, but maybe have something high in fiber with the meal. Like if it's just sandwich bread that doesn't have a lot of fiber, get some spinach on there, maybe sliced tomatoes on there, maybe have a cucumber salad on the side, or have some hummus, or with some fruit on the side. So there's a lot of ways we can add fiber. But net carbs is something that I don't teach unless you are on an insulin pump, and you have to be very precise about your carbs versus your insulin intake. But there's so much information in here. The non-starchy vegetables I was telling you about, yes, some of these do have carbs, like Irina was telling me, and I thanked her for bringing that to my attention. But we don't count this as part of the carb total. Carrots are going to have carbs, but it doesn't mean they're bad. And I hear that the most. Oh, I know I can't have carrots because they have a lot of sugar. We use total carbohydrates. We don't use sugar to identify a food. And these are very low in carbohydrates, very slow digestion, very high in fiber. So we're really not going to count these into the total carb count. And there's a whole list on here. Ask your family member, which of these vegetables do they like? You might be surprised what they're going to say. Maybe you've never brought sugar snap peas into the diet, but your loved one likes that. Well, start buying that. Maybe you've never tried spaghetti squash. It's so delicious. It's a pure non-starchy vegetable. If you use the spaghetti, I mean, somebody who's Italian is not going to do this, but if you don't mind using a substitute for like the pasta flavor, it's not has the pasta texture, but maybe not the flavor. And then you could have a few slices of garlic bread alongside. So there's a lot of ways that you can use these vegetables to enhance the volume on the plate. That's what they're there for, to create volume, add fiber, slow the digestion. We have a whole list of protein foods. So, handouts are lovely and they're fun to have, but in my experience, my patients never read their handouts, but they might go on the diabetes.org website and look around and see the information here that they can find. I love vegetarian proteins, especially edamame and soy nuts and using peas and lentils as protein sources. They are also carbs, but honestly, if we're going to fill our plate with lentils and edamame, our blood sugars are not going to go high very quickly at all. So these are good sources of protein. Fish and seafood are the least calorie protein sources. If you're on a weight loss journey, this is another category to check into. Chicken, turkey versus beef or pork are going to be lower calorie options, but this is the glue that keeps the carbohydrates digesting longer. These are important parts of your meal. In any way, shape, or form you can add protein to meals and snacks is going to be the best blood sugar wise and fullness wise. So there's a lot on here. What I wanted to show you is there is a whole section on recipes. It's a different website, and I want to stop the share and take you there real quick, and then I'll let Arena have the rest of the conversation. The website is, and I didn't write it down, diabetesfoodhub.org. I'm going to bring it up here real quick. Diabetesfoodhub.org. I know it's kind of a weird name, but diabetesfoodhub.org. I'm going to share my screen again with you. You want recipes? You want to become a member and they can save your shopping list. You can, change the servings of a recipe. This is an amazing tool. This is diabetesfoodhub.org. You can get to it from the website, but it's a lot of clicking around. I just type it into my search bar. We have everything from popular recipes, vegetarian recipes, Greek vegetable pita pizza. Let's look at that one. That looks amazing. There's so much you can just say, I just want to see side dishes only or just entrees only. Let's jump to the recipe, and it's going to give us the nutrition facts. So we're going to have pita bread as the crust for our pizza. That's going to save us some carbs. We're going to put all the things on there we normally put on there, the sauce, the olives. You can add some turkey pepperoni maybe instead of regular pepperoni. You're going to bake it in the oven. And it's going to give you a nutrition fact. And this is interesting. So remember this, the serving size is half of the pizza. So if it's a pita bread, those are kind of small anyway. You might have to double the nutrition facts if you're going to eat the whole thing. And that's probably what I would do. But half of it, we'll just zoom right to the carbs, is about 19, let's say 20. So the full thing is going to be 40 carbs. That's great. That's right in the middle of where you should be carbohydrate wise per meal. You can add a side salad, which in this case, have a Greek side salad, get some olives in there, maybe some avocado in there. You can add more protein to the salad and onto the pizza, maybe some grilled chicken instead of a pepperoni. There's a lot of ways you can add more protein because 6 grams of protein is probably not going to be enough to make you super full, but you can add cheeses. There's other things you can add, but you can go for days on this website and never see the same recipe. You can search how you want to find the recipes. If it's just entrees, if it's just something with corn in it or something with pasta in it, you can locate that too. So I just encourage everybody to go on this website. You're going to find a lot of information. Maybe something will inspire you to try on this website. The pictures are beautiful. They really, it was like, yeah, I can do that. I can make that. That's easy. So that's the end of my presentation today. Thank you for your time and attention. Arena, take it away.
Oh, thank you. Thank you, Kim. And I think this is information that should bring peace to everyone because I know that getting this diagnosis, type 2 diabetes, all of a sudden, I wasn't prepared. I've heard so many horror stories. It's something that could be very overwhelming, and I don't want anyone to be overwhelmed. I want you to know that there are ways make um, make make it working for everyone in the family, for everyone in the team. Again, remember, diabetes is a team sport, and you as a coach, you got to be healthy too. So you also need to eat nutritious meal. You need to participate in these dining experiences. You need to participate in these physical activities because if the coach is sick, the team is left without the direction, without the core that keeps everybody together. So let's make sure that you also are taken care of. I wanted to share the list of, let's see how it will show up. Oh, perfect. Do you see everything or you see just the screen, Kim?
Yeah, I see it. I see it. I see
Yes.
everything. You can maybe enlarge it, enlarge the screen.
Okay, let me see if I can do it in a different way. Stop share and share again in a different way, like this. This way I will lose. Here's this is the best I can do at the
Yes,
moment.
that's perfect.
And so the um the it's back. It's not that perfect anymore. Anyways, what I wanted to say here is that I personally went through this. I was and I am a caregiver, but I experienced that too. I experienced fear. I was scared. I cannot explain how much when we learned that my husband got diagnosed with this type 2 diabetes because I knew his personality, I knew his relationships with food, I knew his love for certain dishes, and I did not know how we are going to live if he will be limited of this food. And of course, I wasn't as educated, so I thought we have completely eliminated, and I didn't know how we will live. Uh, I felt grief, just like anyone, about the life that we used to have and could carelessly consume anything and go to different places and eat whatever we want. This one fact that never comes to mind is diabetes is not overnight diagnosis. Diabetes was building up. So if 2 weeks ago we still were doing it and everybody is alive, it means we can do it today too. It just may bring complications if we will not be more careful. So we have to go through this grief. It's natural for human being, but along with the person who is diagnosed, you also are going through that. Recognize it, let it sink, understand it, and move on. You don't want to stay there all the time. Frustration, it comes along with the fear. What we are going to do now? Now I have to cook for them different way, and because everybody else wants to eat this. Well, slowly but surely, knowing what Kim just explained, we can actually start making some adjustments, some changes, some difference in the way how we plate our plates, some difference in what we are pouring into our glasses. And who knows if your person likes the sparkling drink, it doesn't have to be, even doesn't have to be diet drink. It could be sparkling water with a splash of juice or with a slice of some favorite fruit like lemon, orange, strawberry, raspberry, maybe even cucumber or basil leaf. As long as if it is the flavor that people like. And this is actually can be very beneficial for everybody. When we're talking about shame, I do remember a friend of mine when she learned that the way how she cooks food actually not very healthy way. And I do remember how she burst in tears, asking her son and her husband for forgiveness that I didn't know. I swear I didn't know. I didn't want to harm you. This explains why you have these results of your health. So it happens. Some people more emotional, some people less emotional. You are not the person to blame. There's a lot of things happening around us that we don't get enough education. Even doctors don't get enough education on nutrition when they go through their medical schools. What talk about the regular population? And the school system is feeding our kids such a not a good desired diet that is being embedded along with every other knowledge. That's where kids learn how to eat it, and it's not helping definitely. So we can make a change. We just need to understand that it's not your fault, and it's not the fault of the person who got diagnosed. It's the result of lack of information. Doesn't matter when mom is telling eat your vegetables, if mom doesn't have a good understanding why, it's just what she was taught, and she doesn't explain you why, we probably will choose the pizza and the, or pizza knuckles and have that instead of those vegetables, right? A lot of people feel that they're lost, and this is where our Facebook group is coming up because to help, because I know how I felt lost. And if my husband was going to see doctors, I was staying at home. I didn't know anyone. It was such a stigma in our circles. People who had diabetes would not talk about it. They will hide it. They will do different, they will avoid the gatherings, they will not talk about it. And talking about their spouses, they wouldn't talk about it either. So I felt that I am totally helpless, alone, and nobody understands me. Nobody understands me. Doctor doesn't understand me because doctor is talking to my spouse. I was sad because I didn't know what to do. I felt anxious. This all comes together as a package. Um, Lowered self-esteem, this is more about somebody who was diagnosed, but for me as a caregiver, it also applied because I I felt like a loser, that I did not do anything to prevent it, and felt no power at all in terms of making decision, and didn't have any hope. So this is why we have those decided with Kim to have those Diabetes 101 for Caregivers meetings, and we have this Facebook group, as a matter of fact. Where is that? Where you can get help and support, because we are committed to help people who need that help to uh, to learn a lot. I wouldn't say everything because we are also learning every day, but when we know it, we will share. We can reassure each other about uh, the importance of being part of a team, and you are the part of a team, and you are welcome, and you have the rights, and actually you have to ask questions. Some people just sit, and we know with Kim from our support group meetings, when our participants, they join the meetings and they sit quietly, they don't ask questions, but eventually they finally got their questions, and they got the courage to unmute themselves and ask those questions, because sometimes you need to understand the process before you ask the question. And that's what you do. You learn and you ask what exactly was not quite clear for you. And we are trying to don't judge. I mean, if I feel that this is your fault and you are doing this, I probably will not do it in public, and I probably will not do it at all. But if I definitely see that someone is harming themselves, I will point it out. And it's not that you are doing it maliciously, it just you probably don't know that this is something that will help you, right? We can do grocery shopping together. We could do preparing meals together. We could assist with physical activities, as Kim mentioned. I'm going for a walk. Will you go with me? Hey, what about this trip that our friends are going to? Let's join them on this excursion. This is something that we can do together that brings family together, and it also brings some more physical activities into our lives. There are different ways we can help. It's just the matter to be open and not stubborn, like you do it my way. What is it? My way or highway? So don't do it this way. Share, ask, be open, experiment, explore. You have no idea what may be an interest of the person you are liking, you are caring, and maybe you will like it too. Maybe the dance class together, maybe some other activities that gardening that you never tried, and this person never expressed that they like it, but they did it in the past, and now it will be another physical activities. So for you, prioritize self-care. You definitely want to help the person who you care for, but remember, you got to be in shape to be able to provide the help. So I wanted to emphasize it. I wanted to say that we're here to help you because we are in this scheme. We are. Kim is going through it right now. I'm going through it right now. We know how it is important to take care of yourself in order to be always available and ready to help them, the ones who need care for. So, of course, invitation to our Facebook group. It's a private group, so it's not open for the whole public. I personally would like to have people who are caregivers in this group, and I know that some people are living alone and they are caregivers for themselves. This doesn't mean that they are not belong to this group. They do uh, because they can share their experiences from both sides. But more importantly, the reason why I have this I made this decision to keep it private because sometimes people who have this diagnosis themselves, they may become judgmental and they may say not very nice words towards the caregivers. And this is something that we don't want to happen. So we need to understand each other, we need to communicate, and we need to provide the, I don't know, care and love for each other. And what do I have here? Q&As. I did see Aris posted their comment, but it was not the question. The comment I posted was that for the plates, if you don't have the scale, if you don't want the cup, if you don't want to do the constant measuring, there are on sale. You could find it on Amazon, the plates that are different sizes and they're already cut into and designed in a way so you could easily plate your meals in a way like, okay, half a plate, approximately half a plate goes for veggies. Okay, here is the quarter that goes for the proteins. There is the quarter that goes for carbs and nuts and oils and fats. So this is something that is available. And thank you, Aris, about reminding it because we kind of forgot about this. Um, and that's it. This is all I wanted to say today on my part. And I just wanted to thank Kim one more time for being here and explaining everything you said, because this is an important information that a lot of times we don't have time to learn. And sometimes I start looking at the starches and I dive into this and it's like rabbit hole. And before I know it, 3 hours later, I still don't know what to put on a plate tonight for dinner. And what do? I grab some maybe frozen meal or maybe the pasta or whatever it is. So which is not that good.
What I'd like to do is just summarize, and that was great. Always learn something new, Arena, when you tell your story, um, and how frustrating it can be, as the caregiver, and you don't know everything, and you didn't know everything, and it's not your fault that person has diabetes. Something's happened to their body over a long period of time that just was not taken care of. I have a lot of patients that haven't gone to the doctor in 20 years. They're like,
Mm,
oh, I didn't know I had. Well, yeah, you don't go to the doctor. But some things that you can do is just to make sure that they have all the supplies. Do they need you to go to the pharmacy, pick up more testing strips? Do they have all their medications? You maybe should have a list of their medications and make sure they have everything that they need. Get a referral to me, the dietitian, a dietitian, any dietitian. Or even if you feel that, they've been going to their primary care, but their diabetes just isn't still where it needs to be, ask your doc for a referral to the endocrinology.
that
Endocrinologist is the specialist. That's who does diabetes all day, every day. They're also
yes.
endocrine
Hold on,
specialists.
Kim. I'm
Yep.
interrupting you on this point. The story from our life. My husband was diagnosed with type 2 diabetes. It was going up and down, and sometimes very going into very low ends of it. So his blood sugar was out of control. We never got referred to endocrinologist. Never until his kidney failure and the nurse from the kidney floor in the hospital referred us to endocrinologist. So this is something for us as caregivers to be aware of. Medical experts who we need to actually periodically stay in contact with.
Yeah, it can really be life-changing because the endocrinologist knows what to do. I've worked with primary care doctors who are amazing, and then I've worked with primary care doctors who have no idea what they're doing. And that person needs to be with an endocrinologist just for their diabetes care. The primary care doctor can take care of everything else, but let's let this specialist take care of the diabetes. Just make small changes as a caretaker, or just start bringing in diet drinks, alternative drinks. They might really like them, and that's the battle right there. But here's another thing with those veggies. What my mom and I do, like we go shopping together once a week, and what my mom did for my dad is, let's just wash and cut up those veggies. It might take 30, 40 minutes, or we just buy them already cut up, but let's get them on a plate or a container that somebody can easily just, if they want to snack on something that's just available. The available snacks are very helpful, so they're not, going for the chips, or just maybe don't bring the chips in the house. Um, the nuts and the seeds and the avocado and, the fruit with some cheese sticks, anything that you can already have prepared is very, very helpful to your family member. And catch them doing something right. I mean, they're already under a lot of pressure. You might be watching them, how they're eating, but say, gosh, I saw that you had some veggies, more veggies at your dinner. Or I saw that you were walking, and I'm just so proud of you for that. Just catch them doing something right. That's what's going to keep them going to the next thing. And but you need support. And if you need some mental health support because this is a lot to take on, then you need to reach out to somebody to help yourself. I'm sure I agree with that. Arena agrees with that. We needed that support.
Definitely, definitely. Well, thank you, Kim, for bringing this up again because this is important. And we are, with that, since unless there are questions and I don't see it, um, yes, maybe? No? Iris? No questions? Okay. We will stop. Okay, no. Thank you. We will stop here then. We will do the next crash course where we'll be talking more, and I think next time we will be focusing more maybe on insulin because this was something that people really wanted to learn about. For those who missed our previous meetings, the recording of the presentation about A1C is available, so you could see it either on YouTube channel Smart Move 360, or you could see it. Well, you need to reach out to me and get the invitation to our Diabetes 101 for Caregivers group, so you could join the group. And let's see what other questions may arise. But this is what we are planning on doing this year. We want empower you to be the most effective caregiver and the most taken care caregiver that we can do. Okay, this is the end for today, and thank you again, Kim, for being available and generous, uh, sharing your information, your knowledge, your expertise. I mean, 30 plus years in this area. This is something to really take to consideration for everyone.
Thank you very, very much. It's a pleasure. And I have some recipes and some other things I have on my Facebook page. You just look up my name, you can find me.
Yes, absolutely.